So, Dana, could you tell us some of the challenges related to pharmacy services in a rural and remote health authority like Northern Health?
Sure. So I'm Dana Cole. I'm the Regional Director for Pharmacy Services in Northern Health in British Columbia. Northern Health is approximately the same land mass as the country of France, but only has approximately 300,000 people in it. So very geographically large, but very sparse population. But 1/3 of the population, in fact, is centered around the main city of Prince George. And so outlying communities have a lot less people in them. And so most of our sites outside of Prince George have a pharmacy staff of between 3 and 10 people at most. Prince George has about 60 pharmacists and pharmacy assistants and technicians on staff. So some of the challenges that we have is the fact that it is challenging to recruit to northern BC, and it's challenging to recruit to some of the smaller communities. Vancouver, from a weather system, climate is fairly unique, as most people know in the world. It's a very warm climate compared to the rest of Canada. Prince George and northern British Columbia is much more like most other provinces in Canada, and so we actually find recruiting from other provinces to be more successful than recruiting from Vancouver, despite the fact that that's where British Columbia's pharmacy school is. Other challenges is because the hospital is a unionized system and all of British Columbia is under the same structure, community pharmacies are our main competition. And community practice in northern BC, because it's also hard for them to recruit, is able to entice pharmacists with a higher salary, and so we're competing against that regularly. So pharmacists have to be willing to come into hospital for the quality of life and the quality of practice, and not the salary, which can add some challenges.
Could you give a little bit of a background on Northern Health and the history specific to the pharmacy?
Sure. So Northern Health was formed approximately 10 years ago from 16 different health service areas. And so the pharmacy departments, for the most part, were formed when they were still all of those separate communities. And so they evolved within the demands of the time and what they felt would be most appropriate in terms of service offering. Most of the services that are offered are actually relatively common in nature, but they all have evolved in very unique manners. So everyone does things a little bit differently. Now we have one integrated computer system, which is approximately 4 to 5 years old. We all operate on Cerner, and that allows us now to process and review medication orders from anywhere in Northern Health, which is wonderful now, and it allows us to overcome some of those challenges in terms of recruitment and coverage of vacations, sick time, temporary vacancies where it used to be very challenging because we didn't have the casual pool to draw on. Now we can verify from other areas. Pharmacists in the Queen Charlottes can verify for someone over in Fort St. John. It doesn't really matter where they're located. The biggest challenge that has come up with that, however, is the lack of standardization. So there are different ways, slight differences in the way people process the orders, and when the computer information system was built, all of those little nuances were allowed. There was not the effort to standardize put in at that time, and so all of those differences have persisted largely. So what we are now challenged with is trying to overcome that, because it has led to significant staff frustrations and obviously increases the chance that there might be a medication error, which we certainly want to avoid. So we've been working on trying to make some of those changes to make the process more standardized so that we can further support that regional support.
Dana, would you give us some additional information or some detail on how you've approached the quality improvement initiatives in the pharmacy?
Sure. So the staff have been frustrated over some of the lack of standardization, and we have recognized through a number of reports from Accreditation Canada, College of Pharmacists reports, internal audit, that we need to provide more of that standardization. But we've really struggled for exactly the process to do it. We wanted to engage our staff, frontline staff. It was really important for us, and it was also important to have a methodology that would allow us to actually make some headway. The past 3 years or so, it's kind of felt like 2 steps forward, 1 step back, and really needed a bit more organization to it. So approximately a year ago, I heard about Lean as a methodology, and that has been something that has been of tremendous benefit to our department. It's not the only approach that we have taken. It's not the only approach that we will take in the future. But what we did last summer was employ some pharmacy students and had some other staff on project time to collect some processes that were going on in the department and establish exactly how was each department going through their processes so that we could really see what level of variability was out there. And it was substantial. In the fall, we then brought teams together in small groups to do Lean Kaizen events and work through one of the processes. And what we decided to do was attack the patient-specific order processing because it was the one that was leading to most of the frustrations, and we thought that we could come up with some standardization that would really help with that process. For some teams, this was the first time that they ever got to go to another site, that they actually had an opportunity to talk with their colleagues and figure out why someone did something the way they did. It was really important through this that we get strong engagement from frontline staff, and that's who we had in the room. We had pharmacy technicians, pharmacy assistants, and pharmacists in the room. If senior management came in, it was to pop in and see how things were going. We had all of this facilitated with Jane Bishop, who was a Lean consultant for the project. And as much as I had hoped for engagement, what we achieved far surpassed that. Staff finally said that they felt heard and empowered. They realized that although everyone was doing things somewhat differently, they were all attacking the same problem. They were all trying to find the same solutions. And that in fact, they felt that they could now trust that when one of their colleagues worked on a project and determined a process that might work or a process that didn't work, they could take that information and trust that it would also probably apply at their site, and they didn't feel they needed to reinvent the wheel. And prior to this event, these series of events, staff really felt that. They felt that what was learned at one site could not be translated to another site because they were all unique. Staff have felt very siloed. So that has allowed us to create a new desired future state and have goals to work towards. Coming out of those Lean Kaizen events, though, continuous quality improvement on a day-to-day basis still has lots of challenges. We're still challenged with sparse population across geography. It's still 8 to 9 hours drive for teams to get together in a central location. So following up on that work has continued to be a challenge, and we've really gained an appreciation of the need to have coordination through project management and other levels of support to help keep everything on track. It's really easy to get sucked back into day-to-day operations and fall back into those silos. However, staff really are more engaged from the front line and know that they can make a difference and that their voices are heard and valued. Our next process after patient-specific order processing is going to be inventory management, which is another area where we think standardization will not only reduce costs but also reduce a lot of frustrations in the system.
Dana, you've told us about the success you've had in employing Lean and getting employee engagement. What other influencers have you now in place that could impact the success of your efforts?
One of the things that has come into place in British Columbia in the past couple of years is technician regulation. So our technicians are now able to check their own work for processes that we consider at lower risk, as well as perform the final check on products or order entry. Our current system has the pharmacist in the middle of the process or even towards the end, where an order will come down, technicians will take the order, enter it into the computer system, and the pharmacist will complete both the clinical assessment of the appropriateness of the order as well as the technical order, checking the technical order entry at the very final step. Which means that if there's an error in the process because something was unclear about the order, that entire process has to be reworked. It also means that if there's a clinical question about the order, there's a stall in the process, and if there's a change made, then again, rework through that entire process. We now can have a technician at that final stage checking the accuracy of the order entry, so completing the order verification, provided a pharmacist has checked the clinical appropriateness of the order. So through the Lean events last fall, what the teams decided was that it made the most sense and added the most value to the system to have the pharmacist upfront in that process. So pharmacists are going to be deployed as much as possible directly to the wards, or at the very least at the beginning of the order review process, so that the orders that the technicians receive to enter have been clarified in terms of ambiguity, have been assessed for clinical appropriateness, so that the next part of that process can be much more streamlined. A couple of sites have tried this already, and what they've found is that they've had a substantial reduction, probably a 90% reduction in the amount of rework that has to occur because the pharmacists are clarifying all of those ambiguous orders and completing that work up front. One of the other things that's going to streamline this process is the availability of a paperless order management system. Currently, we receive all of our orders by fax. Perhaps because we're a more remote area of the country, we do occasionally have telephone, fax line connection challenges, or it could just be by virtue of the technology that's being used. There are many times when faxes have to be resent. There's many times when the fax quality is not as legible and clear as it could be. There's times when stripes will come down the middle of the faxes. All of these cause problems, introduce risk, and decrease efficiency of the process. We're now going to be moving to a scanning system, which will allow us to have better quality images, as well as faster connections and far less failures of the orders going through the process.